Welcome to Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. It is that one time, that one place that I answer your injury questions, your orthopedic surgery questions, your health and wellness questions. Very, very excited to be here with you and do that. I am Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Very excited to be here. I guess I was here a few weeks ago. I am pivoting these Ask Dr. Geier Lives to once a month, usually going to be the last Friday of every month, and I'm doing that because I am starting a webinar. If you look at the YouTube channel, you'll see it in the channel art. I am doing probably a monthly webinar. We'll see how that goes. The next one is, or the first one is August 9th. I would love it if you would attend. If you click the link in the it's in the channel art. It'll take you to a sign-up page, completely free. Should last about 45 minutes, where I talk to you about joint pain, why the traditional approaches to joint pain honestly don't work very well, may actually make you worse, and talk about some newer ways to get better, even in as little as 30 days, without surgery, without cortisone shots, without arthroscopic surgeries, joint replacements, things like that. So definitely check that out. It is Wednesday, August 9th at 12 p.m. Eastern. All right, let's answer your questions. As always, I am not giving you specific medical advice on this show or anywhere on the internet. I can't do that. This is meant for general information and educational purposes only. I'm not your doctor, you're not my patient, and nobody can give you specific medical advice in this type of social media format online. But very, very excited to be here. Georgia, it's good to see you as always. Very, very excited. All right, we'll start with Elizabeth, and I don't know why these are up here. I'm going to move these down here. Well, except then I can't see it. All right. So Elizabeth asks, will mesenchymal stem cell injections reverse osteoarthritis? That's a great question, and there's a few things to talk about as far as that goes. So typically, the way you get stem cells really anywhere, but in the United States, is either from your bone marrow, where they stick a big needle in your pelvis to get it from your iliac crest, usually through a small surgical procedure, or they get it from adipose tissue, basically fat, and then re-injected, in this case, for osteoarthritis. And the thought is that mesenchymal stem cells then turn into cartilage cells, turn into bone cells, because we know as you get older, especially you get into your late 30s, your 40s and beyond, you don't have many living functional stem cells in your body. And so that's one of the theories as to why cartilage starts to break down, bone starts to break down in arthritis. Now, there's two things I want to say in response to that question. Yes, it's one of those things that stem cells that have been studied, and there's a caveat to the studies I'm going to get into in a little bit, but yes, they have shown to be fairly effective at relieving osteoarthritis pain in humans in a lot of studies. There are studies that show some improvements in cartilage regeneration. I would never tell somebody that it's definitely going to get your hip or your knee or whatever it is back to the way it was when you were 14 or 16. Hopefully it could do that, but I would certainly not bet on that. Do I think it could potentially get somebody better, their cartilage and their joint better than it was before? I think there's a reasonable chance of that, but you just can never guarantee somebody of that. And a lot of times we don't go in and get an MRI or do a hip scope or a knee scope to see if the cartilage changes actually happen, because we base it on, are you symptom-wise better? Here's the other thing, though, in the United States, is that we're not allowed to take the 100 or 300 stem cells in bone marrow that they draw out of your hip and send it off to a lab and turn it into billions. That's not something you can do in the United States. That's why people go to Panama or Antigua or the Caymans or to Germany, where that is allowed. And so I think the studies of stem cells probably are better there than when those procedures are done in the United States, and that's why there's other things being looked at, exosomes, and people do PRP, which is a little more accepted, and there's a lot of research to support that. But long way of saying yes, the hope is to rebuild the cartilage and restore the joint at least a little bit better the way it was before. But at the end of the day, the goal is to get people able to do activities better now and in the future at the level hopefully that they want to be, not just now but going forward, better than with things like cortisone and even preventing the need for joint replacement. So I hope that answered that question. If I can get this on the screen. I'm having heel pain, not sure if it's plantar fasciitis or a heel spur. All right, I have thoughts on that, but I see, should I get x-ray or MRI? I'll give you my thoughts. I can't give you advice. And massage therapy, that's a whole different question. I'll get to that one. Plantar fasciitis or heel spur. Let me show you on my foot and ankle model. They're not necessarily the same thing. A heel spur doesn't mean anything. Tons of people, if you x-ray the foot, have heel spurs on x-ray, a little spur right there that don't have pain, that don't have plantar fasciitis. It means absolutely nothing. It's not even at the site where the pain is typically. And then people that have plantar fasciitis a lot of times don't have a heel spur. So if you have pain in the plantar fascia, this doesn't show the soft tissue that holds up the arch, but that's the plantar fascia. And it's typically right at the base of the calcaneus or the heel bone. By far the most common cause of heel pain. It's not the only cause of heel pain, so that's where it can be important to see a doctor. But it is by far the most common. X-rays typically are not helpful, but sometimes it can be helpful, especially if the physical exam doesn't definitively and the history, the symptoms don't definitively sound like plantar fasciitis. Pain with the first few steps, first thing in the morning that gets worse, or gets better, gets better the more you walk on it, but the first few steps from waking up, or if you've been sitting at your desk or in a chair for a long period of time, those first few steps getting up, walking, are the most painful. Pain typically right at the origin of the plantar fascia on the sole of your foot, and then the exam goes along with that, then I would say x-rays may not be all that necessary. I almost never get an MRI for plantar fasciitis. I'm not sure. I guess the only reason I might do that is if somebody had a traumatic event and there's a concern that the plantar fascia ruptured. That might be the only reason I would do that. Not medical advice in your case, Star, but just my thoughts on x-rays or MRI. When do I recommend massage therapy clients for knee injuries? I don't, a lot of times, I do recommend massage therapy more for my patients that are really more trying to improve athletic performance or just in general trying to feel better with various aches and pains. I don't know necessarily that for a knee injury that massage would be where I would start. I would argue physical therapy with a sports physical therapist probably much more important, but I think there's always a role, and I've worked with massage therapists. When I was the chief tournament physician for a women's professional tennis tournament here in Charleston, I did that for 7 years. They had massage therapists and they were fantastic, but as far as treating a knee injury, especially if you're talking structural damage, ACL, MCL, meniscus tear, something like that, even something like patellar tendonitis or quad tendonitis or IT band, it may have a role. I don't know that that's necessarily the primary treatment option, is what I would say about that. All right, Barry, how long 16-year semi-pro footballer recover from ACL meniscus tear? Currently 1 month post-op. So that's a great question. How long would it take to recover from ACL meniscus surgery? So the conventional rule of thumb used to be 6 months. Now we say for at least pro athletes and college athletes 9 to 12 months. But those are averages, and the amount of time is not really what matters. What matters is getting your range of motion of the knee back, getting the strength back to the same as the opposite side and the way it was before, then being able to land on it and turn on it and all of that. And that is different for everybody. One thing I would say, having done easily 1,000 of those surgeries in my career, is that a lot of times as you get back to a sport, it's the second season back before that knee really feels normal. It takes a long time to learn to get comfortable landing on it and comfortable turning on it and to trust it. And that's why I'm a big believer for a lot of surgeries, but especially ACL reconstruction, working with a sports physical therapist to put you through the drills similar to what you do in that sport to get your knee and get your body ready for that kind of thing. Also to minimize your risk of injury. But we usually, like I said, we used to say 6 months, and that's probably the bare minimum as far as being able to be cleared to play based on, again, range of motion, strength, and all of that type of thing. But in terms of people really being actually able to do their job on the field, more like 9 to 12 months. And that's why you're seeing in the NFL and the NBA, and I'm sure this is true in soccer too, that it's usually 9 to 12 months before you see them back on the field again. All right. What's your opinion of British osteopaths? I'm not in Great Britain, so I don't know that I have any thought on that. Osteopaths in general are very good, at least here in the United States, at a number of things. I don't work with any per se, but I'm a big believer in trying all types of medicine potentially to get better, and all keeping your mind open to a lot of different treatments. My concern, at least in the United States, is that traditional medicine is getting more and more and more driven towards sick care, meaning letting people get sick, letting people eat a bad diet, letting them not exercise, letting them drink too much, and not managing their stress, letting them all these kind of bad things, and then they get sick, and then just the doctors give them medicine to treat it. Now that's largely pushed by the pharmaceutical companies, but it all kind of works together, and we're not focusing enough on getting healthy. Encouraging people to exercise, encouraging people to eat healthy, encouraging them to lose weight, and do all the, get enough sleep, not drink much alcohol, all these things. And so along with that has been this quick fix, just give a pill treatment to medicine, and then it sort of ignores not just steps to get healthy, but potentially other options that are out there to go as treatment. But as far as British osteopaths, I don't have much knowledge of the British healthcare system. And Star, you're very welcome. All right, let me make sure I didn't miss any. I very much appreciate it. Please remember, click the link in the channel art if you want to be there Wednesday, August 9th for the webinar, how to, I don't remember the exact title, how to get overcome joint pain in as little as 30 days without surgery, cortisone shots, and pain pills. I don't remember exactly what it is, but that's the gist of it. It'll be live. I am very excited about it. I've really worked hard, not just on the talk, but on the presentation of it, so I think you'll really enjoy it. So sign up for that. Probably do those at least somewhat regularly going forward. Very excited that you were able to join. I hope you have a great weekend wherever you are. You stay cool, at least here in the United States, and you stay safe. Have a great weekend, and I will see you very soon.